Knock, knock.
Ben.
Hi, Mr. Gomez?
Yes.
Hi there, I'm Christy. I'm the occupational therapy student. I'm going to be working with you today.
How are you?
I'm good. How are you?
Great.
Have you worked with occupational therapy before?
No, I have not.
So, occupational therapists work with our clients in their recovery to get better and to get back to the meaningful things that they like to do and that they want to do and that they need to do. So, we do a whole lot of things, but today I want to focus on your bed mobility, getting you out of bed and into your wheelchair.
Okay.
Okay, how does that sound?
Sounds great.
Are you in any pain right now?
So far, no. I'm okay if you don't move me.
Okay, well, we're going to do a little bit of movement, but we're going to do it in the safest way possible, and we're going to take it nice and slow. Is that okay?
That's great.
Okay, so I see from your chart you had a posterior right hip replacement. Is that correct?
Right.
And do you recall the 3 hip precautions that your doctor gave you?
I don't remember.
Okay, so we're going to go over with them today, and I'm going to make sure that you really understand them because they're very important that you know and that you can you don't break the precautions because that might send you back to surgery, and we don't want that, right?
Right.
Okay. The first one is no bending past 90 degrees, which means if you were to take your top torso and your legs and bring your leg up, it would make a 90-degree angle, just like this.
Mm-hmm.
And you don't want to go past that, making that angle smaller when you bend down to maybe tie your shoes, or if you were to bring your leg up in bed, those things can break that 90 degrees and it could cause the hip to come out of the socket. Okay, we don't want that. So that's the first one, no bending past 90 degrees. The second one is no crossing the surgical side across your body. So if you were to draw like an invisible line down the middle, you don't want to cross that line. You also don't want to turn that side inward. So those are the 3. Can you tell me them in your own words?
I guess you don't want me moving my right leg across my body. You don't want me doing a 90-degree angle, like bending down to tie my shoe on the right side. And I seem to misplace the last one you told me.
So that would be turning inward. So either turning your knee, your toe, or your hip into your body. Kind of like, can you see how I make that motion?
Right.
That's something that you don't want to do because it could cause the new hip to come out.
Okay.
Okay? And also your weight bearing status. Do you know what the doctor told you about putting pressure on that side?
It says as long as I can tolerate it, I guess I can push, but if it hurts, to stop.
Yeah, so you want to stop if you feel pain or discomfort. Okay? So we're going to get you moving. Thank you for having your shoes on. That's always important when we're walking. Now, the other thing is that we want to keep those precautions in mind. So we're going to turn slowly and carefully, making sure that we're not bending too far up or bringing that leg in or turning it.
Mm-hmm.
So we're going to do it step by step. I'm going to tell you what we're going to do, and then we're going to do it together.
Okay.
Okay? So the first thing I need is that your opposite leg, your left leg will come up, and you're going to push through your heel to make sure you're as close to the edge as possible. And then you're going to push through your elbows to get to your hands, and you're going to keep your hands behind you, and you're going to turn your body towards the middle of the bed while we bring your lower body down and scoot your bottom towards the edge of the bed. And then when we have you almost sitting, we're going to drop your legs down, and you're going to keep the surgical side extended, and you can bend the other leg. So we always want to keep that leg out and your body kind of back more so that you're not breaking the 90 degree. Okay, so we're just going to take it slow. Does that make sense?
Yeah.
Any questions? Okay. So let's go ahead and bring that leg up. Okay. And then your elbows will push back.
Okay.
Okay, and yeah, you got that. And then you're going to turn your body.
Okay.
And I got your leg. We're going to keep it out, stretched out. Good. And now scoot your bottom down. Yeah, okay, great. Let's keep your hands behind you. Okay, you're moving fast. Okay, we can bring that down. How do you feel?
A little shorter breath.
Shorter breath. It's very common that people get dizzy when they go from lying to sitting.
Okay.
Okay, so just take a deep breath. We're gonna put on your gait belt. This is for safety so that you don't, that I can help you
Okay.
kind of pull out. And we have to keep it a little snug because when you stand, it will loosen up a little bit.
Okay.
So now when we stand to get to our wheelchair, we're gonna take short steps. So I'm gonna show you what I kind of need from your feet so you
Okay.
can see it first. All right, so you're there, your leg is stretched out. Make sure we're always keeping our legs stretched out and our hands behind us. You're gonna push through that left leg and through your hands to stand. Then you're gonna grab your walker and you can put weight, so you can put your leg down. And you're gonna take small steps forward. And then you're gonna side step and side and get yourself lined up. You always wanna make sure the wheelchair is locked. And I've locked it. It's not gonna go anywhere. And you're gonna step back. Okay, once you feel it behind you, you're gonna kick that leg forward. Reach back for the wheelchair arms. And slowly, keeping your chest up, lower yourself down. Do you have any questions? Okay, so we're gonna take it nice and slow. Remember, we don't wanna cross, we don't wanna turn in, and we wanna push through our hands and our left leg. Kind of bring your leg inward a little bit, it's gonna help you. You're gonna have more leverage. Are you ready?
I'm ready.
Okay. Ready on the count of 3. 1, 2, 3. Push through your leg. Good. Okay, chest up. Chest up. Keep that leg out and hands on your walker. Hands on your walker.
Okay.
Okay, so now small steps forward. You feeling okay?
Yep.
Okay. Remember, keep that leg straight. Good. Okay. Going forward, a little forward. Good. Okay, now you can come back. Make sure you bring your walker with you. Step back. Okay. Step back.
Okay.
Good. And now you bring your hands to the wheelchair.
Okay.
Okay. Kick your leg out.
Okay.
And now slowly, gently bring yourself down. Okay. You did great.
That's it?
That's it.
Good.
Okay, thank you.